How does childhood head trauma impact long-term mental health? Imagine a young child hits their head during a game or a fall. While they might seem fine at first, head injuries like concussions or more serious brain injuries can have lasting effects that go beyond just a bump. When a child's brain is injured, it can change how they think, feel, and behave for many years. The severity of the injury, the part of the brain affected, and the child's age at the time all play a role in how big those effects might be. Children who experience traumatic brain injuries are at a higher risk of developing mental health issues later in life. They might face mood disorders like depression or anxiety, or even attention problems such as attention deficit hyperactivity disorder. Some children may also experience personality changes or develop post-traumatic stress disorder, especially if the injury was severe or if they had previous mental health challenges. These problems can sometimes appear even if the child had no issues before the injury and might continue or worsen over time. Even mild head injuries, like concussions, can cause emotional and behavioral problems. Research shows that children around 10 years old who have had mild traumatic brain injuries are about 15% more likely to experience mood swings, trouble controlling their emotions, or engage in risky behaviors. These issues can sometimes lead to self-harm or requiring hospitalization for mental health support. Trauma to specific parts of the brain can also cause long-term cognitive problems. For example, damage to the frontal lobe might lead to impulsive or risky behaviors. Injury to the left side of the brain can affect speech, logic, and understanding, while damage to the right side might impair visual skills and the ability to perform familiar tasks. Children might also struggle with memory, problem-solving, language, or motor skills, which can affect their daily lives and learning. Long-term effects of childhood head trauma can be ongoing. Some children develop chronic health issues that last into adulthood, including persistent cognitive and emotional challenges. There is also an increased risk of developing neurodegenerative diseases later in life. Adults who had head injuries as children often face challenges like lower educational achievement and greater disability, which can impact their overall quality of life. The severity of the injury matters a lot. More serious injuries tend to cause more significant long-term effects. Some studies suggest that girls might be more vulnerable to certain mental health problems after a head injury, but research is still ongoing. Prevention is key. Recognizing concussion symptoms early, such as headaches, dizziness, confusion, or difficulty concentrating, can help children get the care they need quickly. Using safety gear like helmets during sports and ensuring safe play environments can reduce the risk of head injuries. Healthcare professionals play an essential role in monitoring children after a head injury, providing treatment, and helping them recover both physically and mentally. In the end, understanding that childhood head trauma can have lasting effects on mental health highlights how important safety, early detection, and ongoing care are. If a child experiences a head injury, consulting healthcare providers for proper assessment and support can make a big difference in their long-term well-being. Remember, every child's experience is unique, and personalized medical advice is always the best course of action.